Cool shoes, by the way. Good. Doing all right? There we go. Got that one.
It feels more open right now for sure.
Yeah.
Especially my shoulders. I didn't realize how tight my shoulders felt until now.
Yeah. Okay. So I was looking at your chart and I saw that you have been having some neck and upper back stuff going on, as well as kind of a lot of kind of pain all over, like in the low back as well. So tell me a little bit about what's going on, what brings you in today.
So I would say I've been somewhat consistent with trying to get chiropractic care. My mom raised me with that, and then when I went to college, trying to find someone that worked for me was a struggle. I know that my cervical spine, this curvature is off. It's very straight.
Yeah.
And that has been a big problem, and I've struggled to find someone and something that works. COVID hit, made things difficult, and I've been kind of bouncing around. And now I've landed here because great reviews, and I've been watching everything that you do, and I just need something that's more personal.
Yeah.
And really trying to like put in that effort to see what we can do to help. I think a lot of my upper back pain stems from up here. Everything has just been tight like my whole life, like all my muscles, nothing wants to move.
Yeah.
That curvature has not changed. And I'm just ready to try to find something that works, because every day it's like I'm just constantly trying to like adjust my posture, my upper back, doing this a lot, and
just trying to get some relief.
And I'm a teacher, and I'm walking around all day. I'm up on my feet all day, and then I bend over to help kids, and it's a lot of pressure up here. So yeah, I'm just like begging for some help.
Yeah. Well, we'll do the best that we can to try and get you fixed up today for sure. The pain that you're having in your neck and your upper back, is it mostly just kind of like a dull, achy tightness? Is it sharp, like somebody's stabbing you? Does it burn?
I would say most of the time it's dull. And it's almost like I just need an adjustment like every hour. Like I need that pressure released. And it sometimes can get sharp, especially on my upper right, up here, like right in there. Sometimes I will just, because again, I've been going to chiro forever, I'll just sometimes hold and kind of bring the blood flow up there because it can get sharp up here. But that's usually when I'm just under more stress.
Yeah. Okay. And then the low back pain, I know you said you have PCOS, is that right? Okay.
Yes.
So the polycystic ovarian syndrome.
Yes.
Some of that is just going to cause low back pain. I mean, that's kind of one of the things. We can see how your low back is moving and what's going on down there in terms of your actual spinal joints and the alignment of your sacrum between your hips and everything, and see if there's any way that we can take some pressure off and maybe reduce some of the pain that you're having there. But some of that low back pain is just going to be a symptom of the PCOS. So it's possible that we may not get that all the way down to zero, especially when you're having a flare-up or anything like that. But we'll do the best that we can to kind of take a look at everything and see what we can do. So no numbness or tingling in the arms or legs, anything crazy like that?
Not really. Sometimes, in like when I'm laying down at night, sometimes I can get some numbness in my hands, and I'm pretty good at trying to stay aware of how I'm sleeping, but it can happen sometimes where I'll get that in my arms.
But if you kind of like get up or move your arms around, it comes back?
Yes.
Okay. And you're not having any numbness or tingling like right now while you're sitting here?
No.
Okay. Okay. Well, let's do this. Let's just see how well you're moving overall. Okay. And then we'll take a look and see how your spine feels. We'll go through and get you adjusted anywhere that you need to be adjusted, okay? So let's have you sit up tall for me. You're going to bring your chin down to your chest as far as you can. Okay, and then look up to the ceiling back as far as you can. A little stiff there. Okay. And look over your right shoulder as far as you can. And then your left. Okay, not too bad. We're not turning to the left quite as well as we are to the right, although the difference is minimal. So I'm not super concerned about that, but we'll see if we can figure out why that's happening. And let's have you stand right here for me. Cool shoes, by the way. And you'll face the door, and then reach down, touch your toes as far as you can. Okay, and then come on up. You're gonna put your hands in your low back and then bend backwards as far as you can. Okay, does that make the low back pain a little bit worse?
Yeah.
Okay, so not too bad there either. So let's take a look at how everything feels. I'll have you go ahead and take the jacket off for me if you don't mind. That way I don't slip or anything. And then we'll have you go face down. Your face will go right here where the paper is, and there's a little handle for you to grab onto. Right by my foot there. How long ago was your last adjustment?
Like 2 weeks ago.
Okay. And you had said something about your mid-back from that adjustment. Was it that adjustment, or what had happened there?
Yeah, it's like the last couple of times I went, it's kind of one of those where I come in and they just go doop down my spine, and this up here always moves. It always cracks really well. But the last few times, it's like, I don't know if it was too hard or something happened or they tweaked a nerve, but it's like I would leave in more pain.
Gotcha. Okay. So this area was just kind of maybe adjusted too much or too intensely. Yeah, we definitely have some stuff going on with the ribs. You felt that pop already? Mm-hmm. Okay. Any pain here? Okay. A little bit tight in this right side of your hip. Nothing too crazy. Definitely tight here. Okay, so we're going to start right up here with these ribs. So my hand's going to go right here. I'm going to give your head a little turn. Keep your neck totally loose for me. I'll do all the work, okay? So we're going to go here. Good. That felt okay? Mm-hmm. All right. We're going to come in, similar deal over here. Nice and easy. Good. Okay. Not too bad to start. Let's have you lay on your back for me now. Perfect. And high on this right side is where you're having that kind of sharpness, yeah?
Mm-hmm. It always feels tight.
Okay. Yeah. Very tight. Okay, we're going to come back to that one. Good. Okay, good release there. Doing okay? Mm-hmm. Let's see what's going on. Okay, let's try this. We're going to go here. Nice and easy, let that head fall. Good. Okay, very tough. So we're probably going to end up needing to decompress you on that side to get that to open up. But before we do that, let's finish clearing out your back. So we'll cross your arms here, and then roll you a little bit. Breathe in, out. Feeling all right there? Mm-hmm. Good. Okay, let's roll you on your side. You're going to face me over here. I'm going to lift this up. Bottom leg straight. Top leg bent. Good. Okay. Breathe in. Out. Good. Other side. Good, just like that. Breathe in, out. Okay, and let's lay you flat on your back. And lift that head up for me a little bit. Good, set it down. Now if I pull here, you okay right there, or does that give you any pain?
No, it's okay.
Okay. Trying to decompress you a little bit here. Deep breath in. Out. Good. Doing all right? Okay. So that helps kind of open everything up. That right upper side was very, very tight. And then let's have you go ahead and sit up and you'll face away from me. Let's take a look at this shoulder real quick. Okay, not too bad, a little bit stiff. Okay, tough. Let's see. Go right here. Okay, let's try that a different way. So place your hands between your lower ribs and your waist, and then just relax your arm. Pull backwards from your elbow. Hard, hard, hard. Pull back, pull back, pull back. Okay, not quite. Let's try this one. Pull back. Harder, harder, harder. There we go. Got that one. Let's try this one more time. So pull back. Pull, 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 pull. Okay, not quite. That shoulder doesn't want to go anywhere. Okay, well, not too bad. Let's have you hop up and see how everything feels.
It feels more open right now for sure.
Yeah.
Especially my shoulders. I didn't realize how tight my shoulders felt until now.
Yeah. So we got great releases in your ribs and your upper back as well as your mid back. The neck on the left side released very well, on the right side a little bit tight. So that's definitely something that we can kind of come back to and revisit as we keep going.
Okay.
Your low back moved beautifully, so I'm not too worried about that. Yeah, overall your spine felt like it's pretty healthy. I don't feel anything that has me super, super concerned. Probably what I would recommend for you is something along the lines of once or twice a month.
Okay.
Probably twice a month for the first month or two that we work together.
Okay.
So every other week just to kind of get things more opened up. And then as you start to do better and you're having less symptoms, we'll taper you down to something like once a month.
Okay.
So that would be my recommendation.